Okay, this is the last part of A Tale of Two Kidney Beans and Dr. Walter Kempner, a play about kidney failure. And we're meeting together again, Ronan and Mary, the brother and the sister. Ronan's in kidney failure, and they're trying to figure out what to do about it so he can hopefully decrease his chance of needing to go on dialysis. They've discovered Kempner. So Mary, who's a medical student, says, I found the Kempner book. One of his doctor assistants wrote a book about their work. He helped thousands of kidney failure patients. Here's the cover of the book. Walter Kempner and the Rice Diet, Challenging Conventional Wisdom, okay, by Barbara Newborg. It's a good book. She goes through all of their work. Kind of has a little bit of gossipy stuff in it too, but it goes through all his clinical work. And he also has, Dr. Kempner, his book of his research study. You want to go look at Volume 2. Volume 1's in German, so you won't be able to read it, but Volume 2 is in English. And he talks about how, people would accuse him of starving the patient. He goes, oh, BS. Their albumin was going up. If he was starving them, their albumin's the blood protein. It wouldn't have been going up, okay? And that's also an indicator that you're successfully treating the kidney disease, okay? Spartan Vegan also wrote a book about the kidneys called Prevent and Reverse Kidney Diseases. And Spartan Vegan, at the YouTube channel, Peter Rogers MD, has a bunch of videos about the kidney, a whole playlist of them. Okay, Mary, Kempner was saving patients from kidney disease back in the 1940s, 50s, and 60s. And then Ronan says, yeah, well, he didn't save all of them, and that is true. Some of them died, okay? But they would have all died pretty rapidly if he didn't save some. Mary, because there was no dialysis routinely available before 1972. Mary says, hey, it's 7 o'clock. Spartan Vegan should be calling soon. Ring, ring, ring. Ronan, hey, Doc, thanks for calling. Spartan Vegan, hey, look, I don't got a lot of time. I'm just going to tell you how to get started. In the meantime, you should be watching YouTube videos about Kempner and the low-fat vegan diet. Ronan, okay, what do I need to do? Spartan Vegan, you must be 100% vegan, 100%. Whole foods, single ingredient only. Most of your calories should come from starch. Everything must be organic. There are too many chemicals in non-organic food. Ronan's okay. And the starches, you should eat as much sweet potatoes as possible because they're very low in protein at 4.5% of calories. You can also eat regular potatoes and white rice. They both have only about 8% of calories from protein, and they're both all 1% of calories from fat, all three of those foods. Ronan, okay. Spartan Vegan, the rest of calories should come from fruits and vegetables. This is the Spartan Vegan diet, which is a very low-fat plant-based diet. It's very much like the McDougall diet and the Nelson diet and the Esselstyn diet. In nutrition school, that we're all called the low-fat fanatics, and that's the one that has all the cures, okay? And that's why you want it. That's based on the history of Walter Kempner, Nathan Pritikin, John McDougall, the guys who cured everybody. As many people, more people than any doctors ever had before, okay? And then here is the Spartan Vegan Pyramid of Health and Nutrition. So basically at the bottom is sort of like social stuff. Try to have good family and friend relationships, manage your stress, get some exercise, do some strength exercise and aerobic, get your sunshine in the daytime, try to get your 7 or more hours of sleep at night, be religious or healthier, have a purpose in your life, all that stuff. Then starches are the bottom of the pyramid, meaning that majority of your calories should come from starches. And that includes potatoes, sweet potatoes, rice, beans, oatmeal, quinoa. Actually, for a kidney failure patient, you don't want to eat beans. Beans are too high in protein. They're about 30% of calories from protein. Okay, so no beans. Rice, again, is about 7 or 8%. Oatmeal is getting in the ballpark in quinoa of around 15%. Potatoes about 8%, same as rice. Sweet potatoes about 4.5%. So sweet potatoes are looking pretty good right there. No oil, not one drop, as Dr. Esselstyn says. No nuts, no seeds or avocados. Too much fat. They're too atherogenic. You don't want atherosclerosis plugging up the arteries to the kidney. No olive oil. It's bad for arteries. Ronan says okay. All right, you should only drink water. No caffeine. It's a vasoconstrictor. It's like the equivalent of stress. No coffee, no tea, no dairy, no alcohol. You have to filter your drinking water with reverse osmosis filter, okay? That'll drop your TDS, total dissolved solids, down to about 5 to 10, which is a good range. You'll have to eat first before drinking that so you don't become hypoosmolar. Ronan, okay. You must quit the protein powder. Protein powder is routinely contaminated with heavy metals. You can read all about that at Consumer Reports, for example. That's all nephrotoxic. Ronan's okay. You got to quit creatine. That can be harmful to the kidneys as well. Ronan says okay. Try to walk each day at least 1 hour, preferably 2 or 3 hours. You can walk on a treadmill and read a book. If you want to walk outside, fine, but you know it gets boring to walk that far outside unless you got something to do. You can listen to a podcast or something. Get some sunshine at least 10 minutes every day. Try to get an hour of sun when it's nice outside. Um, Basically, you want to live like Adam and Eve, but keep your indoor heating and plumbing. Ronan says, okay, I'll do it. And here's a nice painting of Adam and Eve by Jan Bruegel and Peter Paul Rubin from 1615. It's the best Adam and Eve painting. It's beautiful. Okay, so Ronan then returns to Dr. Marshall Waters' office, the nephrologist. The nurse comes in, draws his blood draw lady. Nurse checks his vitals, and then the blood draw lady draws the blood. Then he goes for an ultrasound of the kidneys to make sure there's no hydronephrosis, obstruction, or kidney stones. And then after that, a little time goes by, and he talks to Dr. Walters again. The labs will come back. And Ronan says, how are my labs? Dr. Waters says, well, let's look at your vital signs first. You've lost over 100 pounds. Now you're at your ideal weight. Ronan, thanks. Dr. Waters, your blood pressure has decreased to 110/70. Your hypertension's gone. Are you still taking medications? Ronan, no, I stopped those a long time ago, months ago. How's my labs? Dr. Waters, I've never seen anything like this. Your fasting blood glucose is now 90. Your hemoglobin A1C is 5.2. That's normal. That's as normal as it gets. You don't have diabetes anymore. Ronan, thanks. By the way, type 2 diabetes is always curable, okay? As long as I got a pancreas and they're cranking out a reasonable amount of insulin, it's curable. Eventually, the pancreas is destroyed and you can't cure it, but early on, it's curable. Okay, Dr. Waters says, don't thank me, thank yourself. You did it by losing all this weight. Thank the Mediterranean diet. To be honest with you, I've never seen a patient get such great results from the Mediterranean diet. Ronan, that's because I didn't eat the Mediterranean diet. Dr. Waters, well, what did you do? Ronan, I ate a low-fat, low-sodium, 100% vegan diet, organic only, with no oil, no caffeine, and no alcohol. I also filtered my drinking water with a reverse osmosis water filter. So how's my kidney function? Dr. Waters, your GFR is like a miracle. Your GFR has increased to 55. You've gone from stage 3B to stage 3A. Ronan, great. Does that mean I don't need dialysis? Dr. Waters, well, we need to wait and see. However, this is wonderful news. We will recheck your kidney function every 6 months and see how it goes. Ronan, thanks. Okay, 6 months later, Ronan with his girlfriend Betty, they go to visit their mom's house, and Mary's there with her husband Harold. And they're all sitting in the living room. So the doorbell rings, and the mother, Molly, says, hey, Betty, hi, Ronan. Ronan and Betty say hi. Mama, she says, Ronan, how's your kidney function? Ronan, it's still at 55. Dr. Waters says it'll never get better than that, but that's good enough. If I can stay skinny with no hypertension or diabetes, I got a good chance to keep it like this for decades. Molly, Ronan, I have a present for you. I know you like to go for long walks at the nature center by the river, and I heard there's a lot of beautiful birds out there from a friend of mine who goes out there, so I bought you some binoculars to go bird watching. Ronan, thanks, Mom. And I have a present for you. Betty is pregnant. The baby's due in June. Molly, you did it. That's Mama. You did it. I'm so happy. A grandchild. I'm going to have a grandchild. It's about time. But you have to get married. Ronan, yeah, we're going to get married on Valentine's Day. Mama, that's wonderful. I will help you plan everything. You must get married in the church. I insist on that. Then we'll go to the banquet hall for the reception. Ronan, sounds good, Mom. Mama, what are you going to name the baby? Ronan, Walter Spartan. Molly, Mama, that sounds wonderful. Ronan and Betty, thanks. The end. Okay, so that's the end of the play. I hope you found it helpful.
I love Honey.
Yeah, there's a little bit of about the author stuff, but I think you guys are pretty familiar with that.
It's so funny. I love your play.
Okay. So, anyways, I hope you found that helpful.